Welcome back everybody. So in this video we're now going to talk about a condition called diffuse proliferative glomerulonephritis. And to start this video I actually want to draw your attention to one of our associations, which includes systemic lupus erythematosus. And the reason for this is that this is the most common or classic presentation that they'll ask you about in a vignette. So anytime you see a lupus patient, we know that one of the complications of having lupus is possible renal involvement. And they're often talking about this particular disease, which is diffuse proliferative glomerulonephritis. And so right off the bat, I want you to make that connection. When you think of SLE, I want you to think about this type of glomerular disease. So if we start with looking at the pathophysiology here, we can see that it's immune complex deposition in the glomeruli that leads to complement activation and ultimately glomerular destruction. You should probably start to see a little bit of a pattern here, right? We talked about in the overview video that we have a filtration barrier. And anything that damages this filtration barrier is going to cause a leakage of substances that we would not otherwise expect to see or want in the urine. Things that can damage this barrier include direct insults to the area or substances depositing in the area, specifically the glomerular basement membrane, that then cause a destruction to the surrounding tissues. I also want you to note that this is an immune complex and a complement system activation reaction, which should make sense to you because of its strong association with systemic lupus erythematosus, which is an autoimmune condition. When we think about the diagnosis of this condition, we're going to be thinking about some renal biopsies. And one of the classic findings that I put a high yield button by is this wire looping of capillaries on light microscopy. So if you draw your attention over here, I want you to appreciate how there is significant, or in other words, diffuse involvement in this glomeruli. Remember, when we say something has diffuse involvement, we mean it's spread out. This is different than when we talk about pathologies which have focal involvement, such as focal segmental glomerular sclerosis, in which our glomeruli is more likely to look fairly normal on one side, but diffusely sclerotic on the other side, which we see as kind of this dense pink color on electron microscopy. And this presentation on electron microscopy is associated with this wire looping, which is to say that the immune complexes which deposit in the glomeruli create this thickness of the capillary walls, which is supposed to resemble kind of wire looping appearance. Hopefully you can appreciate that there's overall hypercellularity in this glomerulus, but also notice the difference between lightly pink stained areas versus the really dark pink stained areas. This difference has to do with the amount of immune complexes deposited and is a pretty helpful characteristic of diffuse proliferative glomerulonephritis. Additionally, we can also see some other things on electron microscopy, including some immune complex deposits, and we can additionally see a granular appearing immunofluorescence. And this should make sense to you, right? Because we know this is an immune complex mediated reaction, and thus it makes sense that we might see deposits of immune complexes on electron microscopy and a granular appearance on immunofluorescence, because we know immunofluorescence, if we're able to get something to light up, that means there is an antibody involved in the pathologic process. Next, we're going to turn our attention to some management options for diffuse proliferative glomerulonephritis and overall for this condition, because it's so commonly involved with autoimmune conditions, is we'll need to do some form of immunosuppression. This can include glucocorticoids, cyclophosphamide, or mycophenolate. Otherwise, we're really doing symptomatic management similar to some of our other nephritic syndromes. Remember, a lot of these conditions we can't necessarily reverse, right? What we're really trying to do is slow down the progression of disease in these patients. And so we do that by treating the symptoms, right? If they're experiencing proteinuria, we try to treat that symptom. If they're experiencing edema, hypercoagulability, all of these things that we can associate with our nephrotic and our nephritic syndromes, we were going to treat those symptoms as they come up for the patient and hopefully try to prolong end-stage renal disease. When we think about the associations with this condition, we're really thinking about its classic presentation of SLE, but you also want to think about some more common findings, such as that of hematuria. We are experiencing hematuria because this is a nephritic syndrome, indicating there are red blood cells that are getting into the urine sample. You would also expect to see proteinuria, decreased GFR, and decreased C3 complement levels. So why is this? Well, remember the pathophysiology here. We have immune complex deposition in the glomeruli and complement activation. Well, if you have sustained complement activation, what's going to happen to your complement factors such as C3? Well, they're going to decrease in the serum. And can you remember another nephritic syndrome we talked about in a previous video that we would also see decreased C3 levels in the serum? That's right, post-strep glomerulonephritis. For a similar reason here, right? This is also immune complex mediated, which ultimately activates the complement system, leading to less C3 in the serum. It's also important to note that this condition, right, diffuse proliferative glomerulonephritis, is typically due to something else, or it's associated with other pathologies. And those include things like IgA nephropathy, autoimmune diseases such as SLE, or other infectious diseases. So there's a variety of different ways that they can present this to you. However, the classic presentation that they are going to give you in a vignette is typically going to have a patient who presents with a fever, maybe some knee pain, some arthritis. They could also mention this patient has a rash on their face, maybe in a butterfly distribution, and that this patient is experiencing some serious kidney problems, which they can give you by showing lab values that are abnormal. Well, the association that they want you to make here is that this patient has a presentation of lupus with the rash, the fever, and the knee pain, who is now developing a renal pathology, which could very likely be diffuse proliferative glomerulonephritis. So if you can recognize that kind of association, I think that's the most common way that they ask about this. However, it is important to know that it can present in some other conditions, which we've listed here. So just a quick summary for this video. Diffuse proliferative glomerulonephritis is an immune complex problem leading to complement activation. This ultimately damages our filtration barrier. One of the classic findings we can see on light microscopy includes this wire looping appearance, which is talking about the capillary loops actually thickening themselves, and this notable change in coloration of light pink areas of staining versus dark pink areas of staining. We also know that because this is immune complex mediated, we would see deposits on electron microscopy and a granular appearance in immunofluorescence. Management really involves taking care of the symptoms and trying to decrease the progression to end-stage renal disease. We do that through a variety of things, including immunosuppression. The classic presentation is going to include typical findings of a nephritic syndrome, including hematuria and proteinuria. We're also going to see a decrease in the GFR because of the kidney destruction and low C3 complement levels, which we said makes sense because this condition involves continuous complement activation. The big association we're going to take away from this video is that of diffuse proliferative glomerulonephritis being associated with systemic lupus erythematosus, but we're also going to keep in mind that it can be seen in some other conditions.